We'll spend the next few minutes just giving you an example of how we've used predictive analytics to answer some of the questions that come up as you're thinking about your clinical development and market access. So which set of prognostic factors or patient characteristics will accurately predict outcomes? Can you use these predictors to estimate individualized level probabilities for single outcomes, multiple outcomes? Can you identify the variables that are most informative? So if you are looking at a model, can you rank your prognostic factors? How do you define the optimal response profiles? In other words, from a given sample of patients, who is best positioned to respond based on certain baseline characteristics? And how can you combine all of these to help inform your clinical decision making? And these are some of the questions we are answering when we are thinking through the applications of machine learning, AI in the clinical space. The lower quadrant gives you a quick schema of how you pull that through, assembling a data lake, looking at where you have your baseline characteristics, developing a predictive model. You pick your machine learning algorithm to be able to estimate the individual probabilities, ranking them based on the most informative, and using that as a basis for clinical decision making. So think of a construct where Jane Doe walks into a clinician's office, where the clinician has an app, they can go into it, they have a baseline model populated, they can put in Jane Doe or John Doe's characteristics, and then pop out what the treatment options are likely for them, which of them would work best for them. That's the North Star that we are all working to when we are thinking about reactive, proactive medical decision-making being driven by data, being enabled by some of these AI techniques that we have.